Aloha, I'm Dr. Jennifer Mbuthia, board certified in allergy, clinical immunology, and pediatrics. I'm going to talk to you right now about food allergy anaphylaxis. More specifically, I'm going to talk to you about epinephrine. Epinephrine is the first line emergency treatment if someone is having an anaphylactic reaction. If you or someone in your household are supposed to have an epinephrine prescribed because you carry a risk of anaphylaxis, I want you to listen up real quick. Now, the thing is about epinephrine, while it's one wonderful drug, it comes in a variety of different formulations. So the thing is, you need to know how to use your device that's been prescribed for you. A lot of people are probably familiar with the injectable forms like EpiPen, Adrenaclick, or AviQ, but there are some differences between even these devices. And then the latest FDA-approved device to deliver emergency epinephrine is intranasal. So if you have your epinephrine, but you haven't opened the package or looked online to learn how to use it, I really want you to do that now before you're in an emergency situation. So here's a subtle difference that some people may not be familiar with. So on every device, there's going to be some sort of picture instruction, either on the box or on the device itself. Now, AviQ, when you open it, it has an audio recording. On the inside are graphics that explain how to use it, as well as the audio description. But AviQ, when you inject it, you hold it for 2 seconds. Adrenaclick, when you inject it, you hold it for 10 seconds. So if you don't know the nuances of your device, there's a potential that you might misuse it. Then you've got the intranasal spray, which the tendency might be to prime it and push before administration, just like with your nasal steroids that you might use for your allergic rhinitis. There is a single dose in here. You don't prime it. You just put it up the nostril, aim towards the forehead, and then you push and fire. Now, all of these devices have 2 things in common. One of them is that they all contain the life-saving epinephrine. The second thing they all have in common is that they all come in a 2-pack. That's because you should always have 2 devices on hand, whether it's an injectable or an intranasal. And that's because you might need a second dose before emergency services arrive or before you get to an emergency room. So I hope that has given you a little bit to think about, maybe go and check on before you find yourself in a circumstance where you actually need to administer your device.